Definition of injury and explain. Safety interview. Questions and answers. Question: what is the definition of injury? An injury is damage to the body caused by external force, which can be physical harm or wound. Injuries can result from various incidents such as accidents, falls, hits, weapons, or other causes. They can range from minor, like small cuts or bruises, to severe, such as fractures, deep wounds, or life-threatening conditions. Question: what is the classified into several types? 1. Acute injuries. These occur suddenly and are often associated with a traumatic event, such as a sprained ankle from a fall or a cut from a sharp object. 2. Chronic injuries. These develop over time and are often the result of repetitive stress or overuse, such as tendinitis or stress fractures. 3. Soft tissue injuries. These involve damage to muscles, ligaments, or tendons, such as strains, sprains, or contusions, bruises. 4. Hard tissue injuries. These involve damage to bones or teeth, such as fractures or dislocations. 5. Open wounds. These are injuries where the skin is broken, such as cuts, abrasions, or puncture wounds. 6. Closed wounds. These are injuries where the skin is not broken, such as bruises or internal organ damage. 7. Penetrating injuries. These occur when an object pierces the skin and enters the body, potentially causing damage to internal organs. 8. Blunt force injuries. These result from a non-penetrating force causing damage, such as a blow from a blunt object leading to bruising or fractures. Question: what are the types of injuries addressed? Injury safety focuses on preventing both unintentional injuries, accidents, and intentional injuries, violence or self-harm. Unintentional injuries, falls, burns, road traffic accidents, drowning, poisoning, and sports-related injuries. Intentional injuries, assault, self-harm, and interpersonal violence. Question: what are the causes of injuries? Injuries can result from a wide range of activities or events, including accidents, car crashes, falls, workplace incidents, or household mishaps. Sports and physical activity, overexertion, improper technique, or collisions. Violence, assaults, gunshot wounds, or stabbings. Environmental factors, burns from fire, frostbite, or animal bites. Medical conditions, conditions like osteoporosis, increasing fracture risk, or poor circulation, leading to slower healing, repetitive stress, repeated motions causing strain, such as carpal tunnel syndrome or tennis elbow. Question: what are the types of injuries? Injuries can be categorized in various ways based on the affected body part, mechanism, or severity. 1. By body part, head injuries, concussions, traumatic brain injuries, TBI, or skull fractures. Neck and spinal injuries, whiplash, herniated discs, or spinal cord damage. Chest injuries, rib fractures, lung contusions, or cardiac trauma. Abdominal injuries, damage to organs like the liver, spleen, or intestines. Extremity injuries, fractures, dislocations, or sprains in arms, legs, hands, or feet. Skin injuries, cuts, burns, abrasions, or lacerations. 2. By mechanism, traumatic injuries, caused by sudden physical force, for example, falls, collisions. Overuse injuries, result from repetitive stress, for example, runner's knee, shin splints. Thermal injuries, burns, from heat, chemicals, or electricity, or frostbite. Chemical injuries, damage from exposure to harmful substances, for example, acid burns. Radiation injuries, caused by exposure to radiation, for example, sunburn or radiation therapy side effects. 3. By severity, minor injuries, small cuts, bruises, or mild sprains that heal quickly. Moderate injuries, deep cuts, fractures, or dislocations requiring medical attention. Severe injuries, life-threatening conditions like major fractures, internal bleeding, or traumatic brain injuries. Question: what are the applications of injury safety? Injury safety is applied in various settings, including 1. Workplace safety, preventing occupational injuries, for example, slips, falls, or machinery accidents. Complying with safety regulations, for example, OSHA standards in the US. 2. Home safety, preventing common household injuries, for example, burns, cuts, or poisoning. Childproofing homes to protect young children. 3. Road safety, promoting seatbelt use, helmet use, and safe driving practices. Designing safer road infrastructure, for example, pedestrian crossings, traffic lights. 4. Sports and recreation, reducing injuries in sports through proper training, equipment, and rules. Ensuring safe play environments, for example, padded surfaces on playgrounds. 5. Public health, addressing injury prevention at a population level, for example, campaigns against drunk driving or drowning prevention programs. Question: what are the injury prevention strategies? 1. Primary prevention, preventing injuries before they occur, for example, installing smoke detectors, enforcing speed limits. 2. Secondary prevention, reducing the severity of injuries when they do occur, for example, wearing seat belts, using helmets. 3. Tertiary prevention, minimizing the long-term impact of injuries through effective treatment and rehabilitation, for example, physical therapy after a fracture. Question: what are the common examples of injuries? Fractures, broken bones due to trauma or stress. Sprains, stretching or tearing of ligaments, for example, ankle sprain. Strains, stretching or tearing of muscles or tendons, for example, hamstring strain. Concussions, brain injury caused by a blow to the head. Burns, damage to skin and tissues from heat, chemicals, or electricity. Lacerations, deep cuts or tears in the skin. Dislocations, bones forced out of their normal position in a joint. Question: what are the symptoms of injuries? Symptoms vary depending on the type and location of the injury but may include pain or tenderness, swelling or bruising, bleeding or open wounds, difficulty moving the affected area, deformity, for example, misaligned bones, numbness or tingling, loss of function, for example, inability to walk or use a limb. Question: what are the complications of injuries? If not treated properly, injuries can lead to infections, especially in open wounds, chronic pain, persistent pain after healing, scarring, from cuts, burns, or surgical interventions, disability, long-term loss of function in severe cases, psychological impact, anxiety, depression, or PTSD, especially after traumatic events. Question: what is the treatment of injuries? Treatment depends on the type and severity of the injury. 1. First aid, cleaning and bandaging wounds. Applying ice to reduce swelling, immobilizing the injured area, for example, using a splint. 2. Medical treatment, pain management, for example, medications, surgery for severe fractures or internal damage, physical therapy for rehabilitation. 3. Long-term care, follow-up appointments to monitor healing. Lifestyle changes to prevent re-injury. Question: what is the prevention of injuries? Many injuries can be prevented by taking precautions: safety gear, wearing helmets, seat belts, or protective equipment. Proper training, using correct techniques in sports or physical activities. Ergonomics, maintaining good posture and workspace setup to avoid repetitive strain. Awareness, being cautious in high-risk environments, for example, construction sites. Healthy lifestyle, strengthening muscles and bones through exercise and nutrition.